All right, welcome everyone, and to everyone who's also watching the recording, welcome. If you do have any questions, you're welcome to email or call me with them. So today we're going to have our second in the series of the health class for grown-ups. The sort of my thought about teaching a health class for grown-ups is that very many of us, may or may not have had a health class growing up, but that it was really more focused on either sexual education or don't do drugs, and really, like, many of us didn't get the opportunity to really learn about how our bodies work and sort of sit in awe and wonder at the incredible workings of every single organ system. Every single cell in our body is pretty incredible. So today we're going to be talking about the respiratory system, and this month we've had some conversations about breathing exercises and what types of breathing and how we breathe, whether it's through our nose or through our mouth, and how that changes things. We also talked a little bit about upper respiratory infections and what we can do for those upper respiratory infections, and really like what's going on when we have those. We'll cover that a little bit again today, just as we talk about the different parts of the organ system. So as we look at the parts of the respiratory system, really you can actually, as I'm talking about this, you can even take a deep breath in and sort of feel the breath moving through all these parts. But really, it comes in through your nose, and then you have these sinuses, and we'll look at some pictures of sinuses, and then which is kind of these open cavities. Then it comes down through to your pharynx, and then into your larynx, which is your voice box. And then into the trachea. The larynx is really technically kind of part of the trachea, and then comes down, and then there's these tubes called bronchioles that kind of connect it into the lung, and then it's in the lung, and then it goes into these little teeny tiny air sacs that we'll look at pictures of them too, and then that's where it gets the oxygen comes in, and the carbon dioxide, the gas exchange happens, so that the oxygen can come into your blood and into your body, and the carbon dioxide can leave. And really, this whole process, when we really think about it, is that, we think about these teeny tiny little alveoli, one of the big jobs of the respiratory system is to really prepare the air to kind of come down, to really filter it, but also moisturize it and warm it up. Because if we were to if we didn't have this whole kind of, process to get to the alveoli, and the alveoli were just like there in our nose, like, right where the air first came in, they're microscopic, they're very tiny. So you can think about how even just like if you're sitting around a campfire, that they would be damaged quite a bit by the particulates that are present in the campfire. So that's why they kind of have to be down a few tubes that have, and we'll see there's actually some very intricate ways that our airway has of getting rid of those particulates, because it's not good when it gets all the way down into those air sacs, that either they can't function or else they can collapse, they can get damaged as well. So really, we're kind of looking at a very complex filtration system that has to work, 365 days a year for however many years we have the opportunity to keep breathing. So really, this is quite a complex system. So really, the kind of the goal of the respiratory system, right, is to keep getting oxygen into our body, but that goal has to be reached by making that air ready to be absorbed into those alveoli, and ready for that air gas exchange to happen. So really what we're looking at, so first I want to look at some pictures just to kind of give you a little bit of more of an in-depth picture. A lot of us only think about our sinuses when we have sinusitis. I'm going to bring up a picture of sinuses. And I think most people know what sinusitis feels like in terms of, does anybody here not know has never had sinusitis? So here we have a picture of your nasal passages, right? So all of this is happening behind the scenes. So the air comes up through the nose. I always think this is kind of pretty, the way that it looks, when you look at the front of a nose. You can see this when you're looking at people's MRIs, you can see this kind of pattern. So what this is this is not actually, these are this. So this is the sideways picture of this nasal cavity. And these are these there's these bumps that kind of come down, and their purpose also is to kind of help with some of the filtration, but also they're covered with mucus, so they can capture any kind of particulates, and that's basically how they're helpful with the filtration. The other thing we are learning is that these inside the nasal cavity, there is some nitric oxide that's released, and nitric oxide is it's a vasodilator, which means it opens up the blood vessels, but it also we're actually learning that it actually helps a lot with that gas exchange all the way in the lungs. And so this is one of the cases, that people make about why it's so important to breathe through your nose, is because you get that extra nitric oxide. Nitric oxide is also very important for blood pressure. So when people have high blood pressure, there a lot of times people work with that nitric oxide pathway. Garlic is also another great source of nitric oxide. But here we have a way that our own body is sort of, producing and releasing nitric oxide that then helps us, helps our lungs function, but may also, who knows, this is me just saying this is not coming from research, like who knows how much that has to do with blood pressure as well. So we do know that when people breathe deeply through their noses, their blood pressure does go down, but there could be any number of mechanisms involved in that, whether that is more about a vagal tone or vagus nerve stimulation, or whether it has to do with something about this nitric oxide, or probably both. So we do have two sets of sinuses that there's these frontal sinuses, which are like right here under your eyebrows. Again, a lot of people are familiar with that from when they've had a sinusitis. And then there's these ones that kind of sit under here. And a lot of times, if I've ever done this exam on you, a lot of times we press on them to just see if they hurt. And that kind of gives us a sense about whether or not there might be an infection going on in the sinuses. These are cavities that are really, again, like their purpose is, partly to filter the air, but also to make it so that there's sort of a capture zone for any kind of bacteria or mucus to try to keep it from kind of going down into your lungs. So, much better to have an infection in your sinuses than a pneumonia in terms of whether that is like, life-threatening or, what level of concern. So these little sinuses, sort of capture, and a lot of times, something that I use quite often is a neti pot or a saline rinse. And you can see how, you can, as you let the water come up, it's pretty hard. You're not really, when you're using a neti pot, I don't know if you're ever really getting it all the way up into these frontal sinuses, but you're definitely clearing out these maxillary sinuses. And what that's doing is actually just supporting what your body is already working on, which is for that mucus to carry your body makes mucus to kind of carry out the particulates, whether those are bacteria or, campfire smoke or, whatever it is, that mucus is there to carry it out. And you can actually, by using a neti pot, you're actually sort of supporting that mucus. You're sort of almost making more mucus for your body because it has a very similar consistency and salinity to the mucus. And also, very often when you start to develop an infection, that mucus will get thicker, partially because there's more white blood cells, dead white blood cells in there, which creates that kind of whitish or yellowish, thicker mucus. So sometimes that mucus, that thicker mucus, can be hard to expel. And so when you use a neti pot or a sinus rinse, it thins that mucus, so it's a lot easier to get it out. And when I say sinus rinse, I'm talking about the squeeze bottles. I prefer those over neti pots personally, so you can get a little bit better pressure that sort of seems to work better. And also, I don't know, the neti pot, I'm always sort of feel like awkward about it. It's like trying to get it in there. It always feels like it's like not quite doing it right. So the the other thing I was going to say about sinuses there's even sometimes people have situations where they actually kind of grow like a fungus in their sinuses, like a yeasty, fungusy kind of situation. And those can be actually pretty hard to treat because they don't really respond to antibiotics. So people who have kind of like chronic sinus pain or congestion, a lot of times the sinus rinse is really helpful for that as well. And also I was going to say about the whole, a lot of people have a kind of an older understanding of what how you can tell whether it's a bacterial infection or a viral infection based on the color of your mucus. What we know now is that if it hasn't been going on so a lot of people think that, if you start to have yellow mucus or white mucus or green mucus nasal discharge, that means that you have a bacterial sinus infection, so you need antibiotics. What the research shows is that if it has been less than 2 weeks, that antibiotics really aren't that helpful, aren't helpful at all. And that is, in terms of whether or not it's, bacterial or not, when you have more like bleeding in your nose and things like that, that can indicate a bacterial infection. The more greenish maybe, but what you're really seeing when you see the white or yellow is actually dead white blood cells. So that's really what you're seeing. And so white blood cells are active when there's a viral infection and also when there is a bacterial infection. So there's quite a few viral sinusitis, situations that can happen. And that's where the neti pot is really the best intervention. And a lot of people say, I always get antibiotics for my sinus infections, on day 3, and it always makes them better. And and we kind of wonder, like, is it, the research would say that it didn't actually make that duration any shorter, that person would have had the same outcome whether or not they took antibiotics or not. And also too, it's like, well, it's always a tricky one in terms of if that's something that someone has always done, it's hard to not do that. Any questions about the nasal cavity and the sinuses? Mm-hmm. Go ahead.
Just a question. Can you use the neti bottle or neti pot daily? Is there any harm in doing it on a daily basis as like a preventative?
It's actually great to use daily. Yeah, I especially for me, I do it during my bigger allergy seasons, and also during cold and flu season. Is I actually just keep it in my shower. It's great to do daily because it's basically like a maintenance. So if you're in your big allergy season, it's actually helping your body clear out the allergens. And also if that it's if it's during a cold and flu season, you're also helping to clear out any viral or bacterial particles that are present. There's a lot of, kind of back and forth about whether or not you need to use distilled water. This is, I shouldn't say, well, I have to watch what I say on this kind of a platform, but I will say that that is based off of a few people one time in, I think it was Texas, having a brain infection from using not distilled water. And at the same time, people use neti pots across the world without that being a common, side effect or, kind of making things worse. Including people who are in places where water is not as clean as it is here. So anyway, each person can kind of make their own choices about that. And also, distilled water is the safest to use, in terms of if you're using a neti pot, along with salt. You always want to add salt, because if you do plain water, it'll actually, it can kind of change if it's not saline enough, it will actually kind of pull water out of your mucous membranes, which isn't so good.
So I use the salt packets that they give, but can you use regular salt, or is it you have to have a specialized kind of salt for it?
You can. I think you don't want to use you don't want to use iodized salt, but you can use regular sea salt is totally fine.
Right.
And a lot of times people say, there's different measurements. The way that I was taught is just until it tastes salty. So you can kind of just put it on your finger and taste it, but those little packets are great, because the other thing that the little packets contain is baking soda, which actually baking soda is nice because it makes it a little bit less, if you are a person who it tends to feel irritating, it makes it a little bit less irritating as well. So, they're kind of expensive for what they contain, which is salt and baking soda, but it's also nice. It's pre-measured out and you just dump it in and you have the right amount. And, there's a lot to be said for the convenience factor, even though it's a little bit more expensive than just using regular salt. I'm a big fan of the neti pots. They have fancy ones now that do this pulsing effect that's supposed to work with your cilia, which we'll talk about cilia. But they're really fancy if you do have a severe chronic sinusitis. That's an excellent thing to use. And the pulsation ones. But a good old sinus rinse or neti pot can do wonders for allergies as well as for infections. So let's see. So now we're kind of moving down into the voice box, and really kind of, like as I was thinking about this, just, it's pretty fascinating, all of the different sounds that we can make and all of the different pitches and everything from, it's really, and what an incredible coordination that is between these little tiny vocal cords inside and that basically like they're like these two vocal cords that, get closer and farther apart from each other. And then also we're coordinating, of course, with our tongue and also with our diaphragm. So, many people who are trained singers get really, really work on their diaphragmatic movement, and their diaphragm is the muscle that pulls down so that to open up the lungs and then relaxes up to let them close. So it's really, that how much we engage our diaphragm really determines how much lung capacity we have, there's other factors that determine that, but just really determines how much air we bring in, and therefore how much air we can pass through our vocal cords and make different sounds and different volumes and different tones and pitches. And yeah, it's really, really pretty wild. But also too, so much when you look at these sinus cavities too, you can see why your voice changes so much too when you're congested, is because there's really a resonant quality to those open spaces. And so that actually the resonance that happens inside your nasal cavities is something that changes the tone of your voice and really the pitch and everything else. So that's why, you can tell right away when you talk to a person if they're like a little bit congested because their voice is a little bit different. So then kind of moving down further, we're going to think about the bronchioles and then the alveoli. So what I really want to talk about is cilia. I'm going to show you a picture of cilia. Yeah. So that's what they look like. This is actually a microscope photograph of these little cilia. So there's these like little patches. You can kind of see how there's these little separate little patches, and each of these are these little hair-like projections. And what these do, so basically what you want to imagine is that between these little patches, there's these goblet cells which produce the mucus. So there's actually really realistically, like if we were really like looking at this in real life, these would be kind of almost like underwater type little things, so there'd be like basically a layer of mucus over top of these. And then these move in a wave-like fashion. But first, and I'm going to show you a video of how they move because it's pretty fascinating. But I also do want to just sort of bring to light the fact that one of the things that's kind of coming up in the COVID research right now is that COVID has a very damaging effect on these cilia. And so that's part of, and definitely we know that COVID affects the epithelial tissue, which is like all the cells that line our mouth, our throat, our digestive tract, everything else. But it does seem like COVID has an effect on these cilia. And really these cilia, we can't see them. We don't think about them very often, but they are profoundly necessary for our well-being. Both, we looked at them in the GI tract about how they help with the absorption of nutrients. And then we also now see them in our respiratory tract as a way that we get rid of particulates and things that we don't want to be inhaling. And so cilia, they're so small, but they have such a profound change. These cilia are not about absorption. They're really about movement. So there's a term called mucociliary clearance, which I remember I was like studying with a friend, and I still, whenever I hear that term, makes me laugh because we were like mucociliary clearance. I don't know. It's just a funny word. It's like, but basically it's like they are, they're really more a movement function of movement. They're as far as we know, there's so many things in the body we find out later that they have more functions than we even realize. But as far as we know, they're really about movement. And the other thing that we want to think about a lot when we think about cilia is that that smoking actually paralyzes the cilia. So and that's partly like so that actually allows that smoke to kind of come in, but also the smoke itself, the tobacco, actually paralyzes the cilia so that they can't do their job of getting everything out. And that's part of why when people wake up in the morning who are smokers, they often have a smoker's cough. That's actually part of why, is because basically their cilia have woken back up and they've done their job and they're getting everything out as fast as they can before the next cigarette comes in. It's also why, a lot of times, children and family members of people who smoke will often have a greater risk of infection, of respiratory infection, ear infections, things like that, because their cilia are affected, even though they're not the ones smoking. So these little cilia, do quite a lot. And just by the fact of knowing that, like, people who have their cilia paralyzed, by smoking, their risk goes up so much more of infection. It makes us know how much these little cilia are doing to protect us all the time from infection. And I'm going to show you a video of the actual movement of the cilia. Can everybody see that? Okay.
To a video microscopy recording of live tracheal tissue, you can see the tiny beating cilia as flicker throughout the image, and debris floating on the mucus layer as dark spots moving slowly across the field.
You can actually see those little particulates moving out from these tiny little movements of these. And it's really, in that, so really the movement is like a wave-like movement too. I've seen other sort of diagrams of it, and the way that it actually, this one was the coolest one because it was really like a microscopic. I mean, so many of them are this like kind of artistic rendition of what it looks like. But I really love this one because it's like, oh, that's it in real time, real life, is that's like, you can actually watch how those little cilia are like moving everything, and they're moving everything like against gravity. And, meanwhile, we're like breathing in and out, and they're still there being like moving everything out. It's really amazing that they can do that. But the actual movement, it looks a lot more like a wave, like you would see like an ocean wave kind of coming. So it's sort of like this, but it's happening quite quickly. So that's why on the video it just sort of looks like they're like doing this. It's because it's kind of like, those waves are happening very, very quickly. But if you slow it down, it really does look like an ocean wave. Yeah, it's pretty wild that they're there doing all that. And then kind of the other thing too that we want to think about in terms of like what's happening in the respiratory tract is that there's a lot of humidification of that air, and also the warming of the air. So if cold air were to hit the alveoli, it would be a bit of a problem in terms of the way that those little blood vessels. So let me show you a picture of the alveoli, and kind of it can make more sense of that. So this is this is like a tissue picture. When we are learning about pathology and everything, we look at a lot of these pictures, and each kind of tissue has a very different look to it. So you can remember how it looked when we were looking at like the gastrointestinal tissue, how it really had this like up and down kind of quality. So what we're looking at is lung tissue here. And you can see, so these are the little alveoli, which are like the little air sacs, right? And then you can see this is a bronchiole because of the way that it's a bigger sort of piece, and it has this kind of cartilage around it, and then it also has this like more cells involved here. But you can see what the purpose of the alveoli here is, or not the purpose, but the way that they work is that it's really a single cell wall, single cell around here. And then the blood vessels are right, these little red spots are all red blood cells. And so the red blood cells actually come to the alveoli, they get rid of their carbon dioxide, and then they take in the oxygen. And then they carry that oxygen all the way back through the body and deposit it into your little pinky finger. It just, they just, and then they get transported back to the lungs where they get oxygen, and then they transport it back out to your body. And pretty amazing when you really look at that. And then also too, here's a good time to really think about bronchioles and what's happening when in situations like asthma. So in asthma, what's happening is that there's two components to asthma. One is that the bronchioles constrict, and the other is that they make more mucus. So the bronchial tissues can create mucus as needed. So because if a bronchiole, which is the tube, we're talking about the tube that kind of goes into the lungs and into if they sense particulate, so say like, you cough if you're like in smoke or something, basically it's your lungs have produced a little bit of this extra mucus, but also they constrict a little bit because they don't really want to let in air that mechanism is very important for us, right? So like if we were to suddenly walk into a place where there was like a lot of smoke, we would want less of that air to get all the way into our lungs because it's damaging. So the bronchioles really need to have this mechanism to sort of close down a little bit and sort of filter a little bit more when needed. But what happens in asthma is that that mechanism is altered or sort of like overemphasized or overdone. And so that things like allergens or things like cold air for some people can make can make those bronchioles constrict and do that same mechanism, but not really appropriately. So it ends up being a problem instead of a help. And so basically for people with asthma, there have two things going on. One is that those bronchioles constrict, and actually most of the time it's actually harder for them to breathe out than it is for them to breathe in. So it's kind of like that constriction really affects their out breath, which makes it just as hard to breathe when you can't breathe out than when you can't breathe in. And then it also makes them have more mucus, and then that creates, whenever we have more mucus, it creates a situation where they're more likely to have a bacterial infection because that mucus is there. And there's kind of this way that mucus is generally good at like getting things out, but also mucus can, if it's hanging out, it can create an environment where any bacteria can actually grow a little bit. And so we actually want to stop that whole process from happening. And that's why we use inhalers and things. For a lot of people, after an upper respiratory infection, they will develop what's called a reactive airway disease. It shouldn't be called disease, but it is. But basically what it is a reactive airway situation where it's almost like they have asthma for a short period of time. Like they get these kinds of like patterns of this airway constriction, some wheezing. They'll often have wheezing, often have coughing fits that are like where they can't kind of stop coughing. Those, rather than it being like a productive cough that then they, cough something up and then they're done, it's more of these kind of coughing fits that are hard to stop and sometimes make people feel like they're going to vomit. Those kinds of coughing episodes can often be related to a reactive airway. And very often people need an inhaler for that, because what's happening for them is that their airway has gotten kind of like a little bit irritated. And so it's a lot more easy to trigger this response of that constriction and mucus production. And so because of that, then they end up in the same kind of cycles of wheezing and coughing that people who have asthma do as well. So we treat it a lot like asthma, actually, with inhalers and steroids and things like that. So to really clear that out. Let's think about anything else about that. When we talk about pneumonia is when there is a bacterial, well, there is a viral pneumonia, but a lot of times when we really talk about serious pneumonia, what we're talking about is, well, that's not true. Viral pneumonia is very serious as well, but bacteria, so all of these mechanisms are there to make sure that we don't get bacteria into the lungs because of how bad it can be. And really, for our very recent ancestors, pneumonia was something that, even for people of all health and age ranges, pneumonia was life-threatening before antibiotics. At this point, it still is life-threatening for a lot of people. And also antibiotics make it much less so, very much less so. I actually heard a statistic that it was only a little bit more than 100 years ago that the average life expectancy was 40 years old. And so much of that has to do with antibiotics, because so many people died before the age of 40. So people still did live, into their 70s, 80s. But, just really like the advent of antibiotics, like really lengthened our lifespan so significantly. That's the big turning point there. And all the other medications and surgical interventions and everything else as well. But really antibiotics, I think I would attribute the biggest turning point to antibiotics themselves, because of how much infections like pneumonia used to really have a very large mortality rate. So I think that's about all I have for today. Any questions about this or about how the respiratory system works, or go ahead.
Just about humidification. Mm-hmm. So it's important to do that during the winter time because you have dry heat, correct?
Yeah.
So it's cold air that cold humidification that's better? Like, when do you use cold and warm air? And then do you have any recommendations for type of humidifiers? Because I find to get the large ones, it's hard to keep them clean. So, all right. So just your thoughts on that.
They can definitely be little like mold, mold carriers, and so in terms of cold versus warm, actually the research says that there's not really a big difference there, which is interesting. I often, think of warm as being, really more soothing, just because of it sort of feels that way, but really that's not backed up by that statement that I just made is not at all backed up by research. It's actually, it's pretty equivalent, the two of them. In terms of humidifiers and how hard it is to keep them from becoming mold reservoirs and just kind of like throwing mold into the air, that actually, the humidifiers is a place where I do recommend using distilled water. You have to add salt because otherwise it won't actually come up into the humidification. But if there is, aerosolizing any kind of like any, things in the water can be problematic. So I do actually recommend distilled water plus a little bit of sea salt. For when you're using the humidifier. There's also these ones that I find that actually are easier to keep clean and easier for kind of longer term use, because you're right that the forced air, I see all kinds of people with like really dry mucous membranes. Sometimes people get nosebleeds, sometimes people get your risk of infection goes up because of the way that like that makes the mucus not be able to do its job, because it's dried up and it can't move like we watched it move on that video. And so there's these little ball ones that that they kind of just like sit there and they are sort of like releasing water into the air all the time. The other thing that, because it's hard to actually humidify like a whole house, another thing that I actually really like, I have a little USB port humidifier, and it's nice because it actually has like it's like a thing that hooks onto like a tiny water bottle. And it's nice because you just like, it's easy to clean, it's very small, and also it's just very directed. So you're not getting the effects, because sometimes too, if you do, a lot of humidification, you can actually grow mold in your house, so for people who want to use a humidifier in their room every single night, that's great. But also you run this risk of it kind of like creating a little bit of mold around, right, because of how humidified it becomes. So that's why I like those ball ones, is because they don't kind of overdo it. And they also do humidify the room. But if you want sort of more, if you feel like your mucous membranes are dry and you just sort of like feel like you need a little bit more humidification, those little USB ones are great, because you can hear you and you kind of have it. They also have these like little masks that are it's like a little mask thing that you put over your face that is humidified. Some people use that when they have, instead of using like a sinus rinse, or, I guess you could also use it along with one to like just sort of get some humidified air. You can also just do it where you take like take a cup of tea, or you take like water, put it on the boil it and then take it off the heat. But really it's actually great to do with a cup of tea. You can just kind of sit there and inhale it, and for a little bit. But yeah, I like those little USB ones, and the little ball ones are good. I actually don't know the name of the ball ones, so sorry that I'm just calling it the ball one. But yeah, I think if you're looking for a ball humidifier, I think it'll come up. Yeah.
I have a question.
Go ahead.
About the active breathing and the diaphragm, and what controls how much air you get in. As a former marathoner, I learned about how to double breathe and force more air into my lungs, and that would do all kinds of good stuff, getting rid of lactic acid and all that. I noticed it with this cold. I just I'm walking around and I realize I'm not breathing. I'm like, the air is stopping right here. Yeah. And I was forcing myself. I was double breathing because I was also getting a little dizzy.
Oh, huh. Yeah.
So, but I was wondering, was that the bronchitis? Because I know I had junk in my tubes.
Yeah, totally.
I was coughing out.
Could definitely be that. And also, just like when I mentioned about that reactive airway, there could be a little bit of that. Did you have any wheezing? Like, did you hear like that sound that's like, like that?
Yeah, at the end of a cough. Yeah.
Yep.
Yeah, I was doing
so
that.
So definitely there's probably a little reactive airway going on there in terms of there being kind of a slight constriction of those bronchioles. And, and sometimes, if that persists, we definitely, want to get you in for an inhaler, just to use for that period of time, because that can definitely be what's happening, where you just can't, when those bronchioles are constricted, you really and there's also mucus present, you can't really get that full breath in, you can't. And that's why pneumonia gets so serious so quickly, especially if you're feeling dizzy. That's definitely a time to come in for a lung check and a pulse ox check. Pulse oximeter is just that, how much oxygen is in your blood, just to make sure that your lungs, because you can, if there's like constriction in those bronchioles, what can happen is that your lungs really never fully inflate. And really it's like that double breathing, what you're doing with that is like that extra level of inflation actually really does a lot for more alveoli being kind of recruited or being active, so when you do kind of like shallow breathing, right, you're not inflating your lungs quite as much. So if you think about the fact that the air has to get all the way to the end point for it to actually do anything. So if you're really shallow breathing, I mean, you'll still get some, but really you're kind of only inflating these kind of inner alveoli, right? But if you do like a deep breath and your full chest expansion, and and really you're filling up all of those little alveoli, all of a sudden you're getting a lot more, you get exponentially more oxygen and carbon dioxide exchange, which is why people who are athletes are really training themselves around that, because you need that extra percentage, like you can't. So if you do, if you have like a half breath, so say you've got a 50% breath and you do that, when you're breathing hard, it would be kind of like 20, 30 times a minute. How much more effective it is to get a full breath, 15, 20 times a minute, right? It's like, you're actually, because with each one, you're getting 5 times, I made that number up, like about, 5, 10 times more oxygen with each breath. Because of that way. Am I making sense? I feel like it's like, might not be making sense. That kind of like full expansion. So whenever you have those bronchioles constricted, it gets really hard to get enough breath in to like open up the whole lung. So you get a lot less oxygen. And that's
okay. So it's not a function of the diaphragm at all. It's not like some other mechanism wasn't not functioning. I mean, It's just because it all seems so automatic. It was just like stopping.
Yeah, totally.
Okay.
Yep, that is exactly. It's like there are certain times where people's diaphragm can affect their breathing, where it's just because they're slouching, or because they're because they're shallow breathing, or because they're nervous, or they're breath holding. There's times where that diaphragm can affect, and that's where you've trained yourself. But in your situation, what you're describing, it is actually more of a mechanism that's happening inside your lungs, that's making it hard for that to move through. Yeah.
Okay.
Mm-hmm.
Let's see.
Anything else? Any other questions, or?
I think that's it for me.
All right, great. Wonderful. Well, it's really wonderful to see you both. And just a reminder that we have our first in-person cooking class happening on November 5th at noon in New London. It's going to be all about lentils. So that's a Saturday. So we're going to learn about a lot of different ways you can incorporate lentils into your into different recipes in different ways, and also learn about making lentil tofu, which is actually incredibly delicious and can be used in so many ways. I just made it last night. It's really wonderful. So yeah, wonderful to see you, and please don't hesitate to reach out if you have any questions that come up.
Great.
Okay,
You have a
you.
wonderful day.
You too. Take care.
Bye.
Bye-bye.